All right, so let's start with the big story that we are tracking and beyond at this hour, where the EU's drug regulator has said that it is still deciding on whether the AstraZeneca coronavirus vaccine is actually causing blood clots. Now, talking to AFP, the European Medicines Agency Safety Committee has said that it has not yet reached a conclusion and the review is still currently ongoing. The committee is set to hold a press briefing sometime either today or tomorrow, depending on when the review is likely to be finalized. Now, the European Medical Agency statement comes after its head of the vaccine strategy, Marco Cavalieri, was in fact quoted in the Italian media saying that there is a clear connection between the vaccine and the blood clots, but it is unknown as to what has caused this reaction. He further said that the agency will announce its decision pretty soon. The development, of course, has come at a time when several countries have restricted the use of AstraZeneca over the issue of blood clotting. The European Medical Agency maintains that the benefits of the jab still outweigh the risk, and even the World Health Organization has backed the vaccine. Earlier, the manufacturer AstraZeneca had said that its studies have found no higher risk of blood clotting because a person has been administered the vaccine. All right, now to give us more perspective in terms of what is likely to happen, we are joined by WIO's correspondent Lucy Huff, who is joining us live from Brussels. Now, good morning to you, Lucy. Bring us up to speed with this meeting, this press briefing that we are given to understand is likely to be given by the European Medical Agency. Do we at this point of time know anything at all as to what is likely to be announced?
We know that the press conference is due to start in about 6 hours' time, so 4 o'clock local time, with the European Medicines Agency obviously having concluded this section of its review into these safety concerns over the Oxford AstraZeneca jab and its possible link to rare cases of severe blood clots in the brain. The press conference comes, of course, a couple of days after those comments were published in an Italian newspaper where the head of vaccine strategy, Marco Cavalieri, said that there was, in his opinion, a clear link between these rare cases, around 30 in amongst the 18 million people who've received this vaccine dose, both here in Europe and in the UK as well. The cause of that link, of that reaction, is not yet known, but we may get some further information from the European Medicines Agency on that later on today. Nonetheless, there was no indication from Marco Cavalieri about whether or not the advice would change. You know, we are still talking very small numbers in amongst the millions of people who've received this vaccine that have this severe side effect. So the advice may not change. The advice may continue to be that the benefits of this vaccine far outweigh the risks in terms of reducing the rate of hospitalisation and deaths from COVID-19 in amongst the millions of people that are expected to receive this vaccine. The vaccine is already restricted in some European countries, France, Germany and Spain amongst them, in younger age groups, in the under 60s, because the majority of the people that have reported these incidents of severe blood clots are younger and around 80% female. So we are expecting that advice later on today, but no indication exactly on what might change.
Absolutely, indeed. Now, this, of course, is something that we'll be tracking very closely. But at this point of time, a lot of European nations have suspended the use of AstraZeneca, including the likes of Denmark, Norway, Iceland, Austria, Italy, Bulgaria, just to name a few. Now, in the event, the European Medical Agency comes out and says that the vaccine is still safe and that they believe that it is still, the benefits of the vaccine still outweigh the risk of blood clotting that have been reported. Will there be any change in stance in the use of the AstraZeneca vaccines in the nations that have suspended its use?
Nations suspended the vaccine for a period a few weeks ago after fears of these blood clotting incidents. But after the last ruling from EMA, which ruled that the vaccine was indeed safe and effective, and that the benefits far outweighed the risks, a number of countries then reversed that decision, Germany, France and Spain, for example. Since then, there's been a shift in position from some European countries, for example, France and Spain, who've restricted the vaccine in younger age groups amid continued concern about this risk of blood clotting in younger age groups. Germany amongst them too, restricting the vaccine in the under 65s, in the case of Germany in the under 55s, amid concerns that these incidents of blood clots seem to develop particularly in younger people. This is what's called cerebral thrombosis, which is severe blood clotting in the brain. Of that 30, there's been around 9 fatalities. So whilst the vaccine is fully operational in some countries, such as here in Belgium, there is this partial restriction in younger age groups in some European countries. If indeed EMA comes out and says that the vaccine is safe in all age groups, we may see some countries reverse that position. But we've even had a change in position in some countries since EMA came out and said the vaccine was safe. So it seems that countries are able to do essentially what they feel is best according to their own national regulators. And it may be that countries keep some restrictions in place, even if EMA come out and then say, according to them, the vaccine is safe.
Absolutely, indeed. This, of course, is a press briefing that we'll be looking at very closely. Thank you very much indeed, Lucy Huff, for joining us from Brussels and bringing us up to speed with what is happening in Europe. WIO is now available in your country. Download the app now and get all the news on the move.